Thank you very much for inviting me. I'm very honored to be here with you. So I'm going to share with you my experience about the cellulite. Cellulite is extremely hot topics because I'm dealing with cellulite for more than 15 years. In that time of period, I have tested and I had all possible devices on the market. So even today, I have all possible devices, including invasive, minimal invasive lasers. I have also J-plasma, radio frequency lipolysis, and so on. But if you ask me which is my favorite device, I would say that this is a beautiful device, Endolift, Eufoton device, 1470 nanometer. In my country, I live in Croatia, in Zagabria. All my clients want immediate result. They don't want the downtime, and they want a single session, and they have a long-lasting result. So until I got this device, it was pure magic. It was not possible. So I'm going to share with you how I'm dealing the cellulite with this beautiful device. I call this treatment, we speak about interstitial laser therapy for the cellulite. So this is something completely innovative, because we directly target the place of development of the cellulite. The most of other devices direct cellulite indirectly. First, you must know that cellulite is not an aesthetic problem. It's a disease. It's a chronic disease of connective tissue, which undergoes the degenerative process of collagen, like hyperplasia and hypertrophy. As a result, the microcirculation is blocked, followed by the extracellular exudate, and then comes local toxemia, and later with systematic toxemia. So in advancing stages, you have many diseases which come together with the cellulite. You feel fatigue, you have problem with the headaches, problem with the thyroids, and so on. So this is a reason why you must consider cellulite seriously. Finally, the fat cells start to grow as a consequence of all these happenings. So we must know that cellulite is not disorder of the fat cells in the first case. So we treat it until recently completely wrong. Our target is the connective tissue, if you want to successfully to treat the cellulite. So there are causes of the cellulite like genetics, lifestyle, food, exercise, and estrogen. Men are protected because of the cellulite, because we have testosterone, which have protective role. So this is the anatomy of the cellulite. So we have skin dimpling because of fibrotic process of the connective tissue, which is completely rigid, and the skin cannot retract. So that's why we go to dimpling. So our idea is that we break those fibrotic septum and rebuild completely new one, destroy the fat cells, and improve the skin texture. The skin also becomes thin. So this is our goal to fight the cellulite. So we must also, when we deal with the cellulite, we must speak about the types. We speak about compact, soft, edematous cellulite, and also combination. But before the treatment, we must also exclude similar degenerative processes of the fat tissue like lipodystrophy and lymphedema. So this is completely different than the cellulite. For the treatment of the cellulite, we focus on the removal of extracellular exudates. We speak about activation of the blood circulation. We speak about fat lipolysis and connective tissue. So this is the most important part. We must remove the damaged one and promote the rebuild of the new one collagen. So there are many different treatments which I won't waste the time. So when we speak about cellulite, we have two options. We speak about non-invasive, we speak about invasive treatment, but now this is something completely new category. So it's about interstitial laser therapy for the cellulite. So this is completely brand new technology, which I find is the future for the final fight with the cellulite. So it's a minimally invasive procedure based on the subdermal laser fiber insertion. Is based on the 1470 wavelength. The most important is in-office procedure. You don't need a surgery room. It can be done with or without tumescent anesthesia. And the most important is that there is no downtime or there is a minimal downtime. In my country, when I treat the cellulite, the most of my ladies tomorrow can go on the beach and to reduce the cellulite. So can you imagine that there is no limit regarding downtime, there is no bruises, there is no elastic bandage and stuff like this. Regarding advantages of interstitial therapy for the cellulite, there are many of them. First of all, it's a one single treatment. It's extremely fast. It's very simple. It has the most long-lasting results. There is no scars. It affects the most of characteristics of the cellulite with a single device. So we don't need more devices. We need only one device to fight the cellulite. So it's very important to say that we can treat any part of the body. I treat legs, I treat inner thighs, I treat knees, I treat also fat part of the knee, I treat hip area, and my favorite treatment is the buttock area, including banana fold, because I don't see a reason why to do Brazilian lifting procedure when you have with this interstitial therapy for the cellulite, because we can remove dimpling of the buttock and at the same time reshape and lift the buttock. Which we cannot underestimate that this is the most important treatment for the cellulite when we go under the skin. So it's about extremely safe. And there is the biggest percentage of the satisfied clients with this treatment. That's why it's one of my favorite treatments in my office, this interstitial laser therapy for the cellulite. So I won't speak about why we choose this wavelength. So regarding laser fibers, we have three options. We can use 300, 400, and 600 microns. Until now, we heard a lot of things about laser. We also heard a lot about pulse duration, T on and T off. But we didn't speak a lot type of the pulse. We have pulsed and we have continuous pulse. So if we use 300 microns, we can use it in two modes, continuous or pulsed. So the most important is when we use this fiber that we adjust pulse duration. So my favorite setting is between 50 to 75 or 75 to 100. Before the treatment, we must determine the skin, how is the quality, what kind of the cellulite. We want to ask the patient, does he want any anesthesia or he want on downtime or no downtime. You also must not forget that bigger diameter of the fibers means better results. So we can play, we have a lot of opportunities. So if we use 300 microns, we don't need to use in most cases anesthesia. It's a Zimmer cooling is enough. I also love 400 and 600 microns where I need to use 2-minute anesthesia. I use as the smallest amount of 2-minute anesthesia. I use, in that case, I use 1 gram of lidocaine to reduce the pain. So we have special design tip of the fiber. We have less radiation, vertical and radial. My favorite is a radial fiber. And the temperature of the tip is 55 centimeters. There is no need to measure the skin temperature. I had infrared camera and pistol, but I recommend strongly that during the treatment you always promote cooling with the Zimmer during the treatment, and also when you finish the treatment at least 15 to 30 minutes, just to be 100% sure to avoid any skin damage on the surface. So this is what I mentioned according to the fiber about anesthesia. So how it works? This treatment is based on the destruction of the fibrous cells, which are completely rigid, and we want to produce the new collagen. We have lipolysis effect, we have improved microcirculation, and we also trigger and tighten and rejuvenate the surface of the skin. Regarding lipolysis, in the most cases, I don't perform liposuction, but there are some places where there is a lot of fat, so it's up to you. I do, if I do liposuction, I do minimal amount removal of the fat to have better result and to reduce the downtime. So this is a photo before and after the procedure. So we see dimpling because of skin retraction of these causing bands, which are fibrous. So we want with the fiber cut them down, and this is how we release the skin. Skin retracts, go on the surface, and we have even smooth surface like we see on the photo on after. So regarding the technique, we are speaking about linear movement. We have a speed 1 centimeter per second retraction. The most important is that we talk with the client properly about the procedure, all details, to have a good photo before and after. And what I like to do is that I divide treatment area on the square about 10 by 10. Why? Because I want to deliver recommended energy per this area. So it's not about the power. It's more important that we choose what kind of the fiber. I said I recommend, in my experience, radial. It's very important that we adjust the pulse, what kind of pulse we are doing, and that we deliver energy according to the pulse duration. As I said, in the most cases I use between 50 to 75 if I want mild lipolysis and more tightening effect. But if I want only lipolysis, then I go 75 to 100 microns. So when we treat the client, we must adjust all those settings regarding to the client. Imagine this procedure, it looks very complicated, but it's very simple. It's like a cookbook. You have recipe, but you can play and put any part of ingredients if you want to improve the procedure. So for the beginning, use the parameters from the cookbook, and then after, when you get experience, you can start to play, experiment, and you will see what is the best option for you. During the treatment, I started to change the pulse duration. So there are places where I want a more pronounced tightening effect, and there are places where I want to have more lipolysis. So by combination, we have extremely 100% individual approach and the treatment to the client, and that brings to the most satisfied client, and we have then extremely good results. Regarding the area which we treat, we can choose between one hole or multiple hole approach. That means sometimes I use one hole. If I use bigger fiber like 400 or 600, I enter on the medial part of the knee, and I go up all the way up to the inner medial thigh, and I then treat completely inner thigh, including the leg, also the knee area. But if we have smaller amounts of the fat, then we can use multiple hole approach. Example, lady has problem on the knee, I enter on the medial part of the knee, and then she has problem on the inner thigh. Then I will directly enter to do this inner problematic area. So it all depends about the type of the cellulite, which approach will we choose. The results. It can be seen between 30 days and are getting better over the next 9 to 11 months, and average duration of the results is up to 3 to 5 years. So I'm going to show you some short video clips. How I can start the procedure. This is where I use 400 microns. As you see, I divided the area, and there I deliver between 1,500 up to 300 to 3,000 joules per this area. It's about that you uniformly deliver this area during the treatments. I did here anesthesia. So as you see, there is a one with this single hole approach. We can treat not only upper part of the leg, but we can also treat the medial fat pad of the knee and the knee itself. So no need to do multiple holes, but sometimes we need to combine it.
Sorry, Dinko, can you say the parameters? So pulse and energy.
Okay. This is the 400 microns. I increase 1 joule. I think it was 4 watts, and then I use between 50 to 75 pulse duration, and finally I concluded with 75 to 100 to 100 pulse regarding the pulse duration. How I can press here? Okay. So this is where I skipped just a second.
You want to go back?
No, I want to show this. If you can help me, please. What to press?
You want to move the video?
No, yeah, move to video.
No,
yes.
it's not possible with this kind of presentation.
I'm sorry. So this is where I treat banana fold. So I'm using also here 4 watts. You can. The most important is, like I said, the power is not important. So it's all about adjusting the fiber and the pulse duration. So if you use 400 microns, you can use the parameters just like you're using 300 microns, but increase up to 1 watt. And the most important, do adjust the pulse duration, because it depends all about the pulse duration. You can have the best technique, the best approach, but if you don't play with pulse duration, you will not have superior result. So this is the idea, but it's also very important that we speak about what kind of pulse we are using. I recommend that we use continuous pulse for the better effect. So this is my experience. So with this device, we can not only very efficiently remove the cellulite, but at the same time, we have the best result for the shaping and lifting also of the buttock. From this single hole, I can treat posterior part of the legs. I can also reach to inner part of the thighs. I treat banana fold. I treat buttocks. I treat hip area, and sometimes I go even up to the saddlebags with a single hole. So there is no need to use more holes. When I didn't have experience enough, then I use it multiple hole approach. But after experience, you can place just like with the game, even with a single hole. During the treatment, it's extremely important that your hand is touching the tip of the fiber. It's just like playing piano. I can, after experience, which I have, you can do it even with the closed eyes. So it's all about that you test the tip of the fiber and you adjust the skin. So if there is some curve of the skin, don't be afraid. What I do, I just stretch the skin and I bend the fiber, so I access any part, even above any curve, even above the skin. So it's very accessible, any part, the most difficult part. So always grab the skin if you have better effects, touch it, and this is very important to have better results. So you see, I treat here this hip area. So in these cases, I also I use 400 microns. You see how I grab the scale, and it's important that you have the contact. On one hand must delete the tip of the fiber, otherwise you don't know in which area where you located. Regarding the results, I do apologize because most of my clients are not from the Zagreb. So it's very hard to get them to see the final results. So the most of the results which I'm going to show you are taken immediately after the procedure or between 7 to 45 days. So here I did the buttock lift reshaping and I hit the tightening of the posterior thigh. This photo was taken only 5 days after the treatment. So we see completely different shape of the buttock and the smoothing of the posterior part of the legs. It was 400 microns. This photo was taken immediately after the treatments. I here did 300 microns. 300 micron is extremely popular treatment because in the most cases you don't need anesthesia, just the Zimmer, and there is no downtime. You do the treatment and the client tomorrow can go to the beach. So this is my favorite fiber, especially for the ladies between 30 to 40 years. This is also immediate effect immediately after the treatment. The beauty of this treatment is not only that you tighten the skin and melt the fat, because at the same time you completely rejuvenate the skin. Skin becomes completely smoother, looking more refreshed. So compare the quality and the appearance of the skin before and after the treatment. It's a huge difference and will get better over the time. So imagine the final results if we see such a dramatic change immediately after the procedure with no downtime. This is also immediately after the procedure. There is no bruises, there is no edema. So it's a completely safe. So we cannot speak even about that it's invasive procedure. It's just like something like the fillers. So this is also immediately after the procedure. So look how is the skin tightened. I did only 400 milliliters for both legs. And also here I did also liposuction of the stomach, but this is not subject of this lecture. So look at the shape and the quality of the skin. So it will get better and better. So I think the final result is going to be better, at least 30 to 40% better than you see on the photo. This is another example. This is 5 days after the treatment. This lady has a huge problem with the cellulite, with the circulation, blood vessel. So she's very prone to have the bruises. So I did the photo, and this photo was taken 2 days after. So we see completely reshaping of the hip area. What I want to say, what forget. So it's very important. When we treat the cellulite, cellulite is a brother and sister with the blood vein and the capillaries because it comes very together in the package. So when you treat the cellulite, the improvement of the circulation of the leg is going to improve significantly. The clients will not have the problems with the cold legs, the swelling, and so on. Because with this treatment, we help them to improve the circulation, and we strongly improve that they do not develop blood vessels so capillary. So this is also a very important aspect of the treatment, which also must to explain as advantage why they should choose the treatment. This lady did a couple of liposuction, laser liposuction, and her skin was completely destroyed, and it was a sagging. You cannot see because when you touch the skin, she had huge skin laxity. So this is a photo after 30 days. So we see fullness of the buttock area and the smoothing of the skin. So on this photo, we see a lot of skin dimplings on the buttocks. So look how is the skin even and smooth after only 21 days. And look how is the tightened posterior part of the legs. So this is another example. This was photo taken 3 days after. So we see huge retraction of the skin and reduction of the volume. And we build up the buttocks. Now, before the photo, we didn't see almost the buttock, but now it's pronounced and it's very lifted. So this is another example. This is a fatty cellulite. When you see this photo, always play 75 to 100, and then finish with 50 to 75 to have a tightening effect. So you have lipolysis and tightening for a better results. On this photo is the same thing. The idea, the ideal example why you need to play with the different settings. So if you do with only 50 to 75, you would have a good result, but not so good if you combine. But if you use 300 or 400, put it in the continuous mode. It's very important. This is another example. The photo was taken 10 days after the treatment. This is the same lady but the other side. So we reduce a huge amount of the fat in the hip area. This is another example of the buttock shaping and the cellulite. Another example, you see here I did a little liposuction. Especially you notice that in the part of the inner thigh. And before the photos we see a lot of skin dimplings, and after the procedure almost dimplings are almost gone. So this is another example where I played 600 microns because a lot of fat. And here I did liposuction. Here it is very good that you do liposuction. Otherwise, the downtown would be more prolonged and the result wouldn't be so superior, like with the combination with the liposuction. I don't have experience with the cannula, with this system. I like the idea of the fiber, so I cannot speak about the fiber. I don't know the result, is it better or not. But the thing is that when you say to the client, one of the advantages of this treatment is that you don't have a needle, you don't use cannula, you just use a laser fiber. So they say, oh my God, then I can do it. So it's very important that you don't know nothing. All you are doing with this treatment, you are promoting your body to produce new collagen, to rejuvenate and tighten the skin. You damage the skin, you help your body, and the body will finish by itself. So it's 100% a natural treatment. You must also explain to the client. One of the problems which I deal almost every day is the bad experience of the clients. They heard on between talk with other ladies, they read on the internet, they did liposuction, they had a lot of swelling, a lot of bruising, and in most cases, when they come to me, say, doctor, do me whatever you want, but don't do liposuction. So you need to tell them, this got nothing to do with the liposuction. It's a completely different treatment. But like I say, classic liposuction got nothing to do, and there is no role in the treatment with the cellulite. So this is another example of the reshaping of the hip area and the buttock. This is another example. So this photo was taken immediately after the treatment. I didn't done any anesthesia. Here I did 300 microns with the cooling. My settings were here 50 to 75. So you see immediate result. And tomorrow she is ready to go on the beach. This treatment can be done all around the year, even during the summer. This is the same lady from the lateral side. This photo is also very interesting. It was 15 days after the treatment. Another example with the combination with the liposuction. So when you speak with bowel client, you must explain them. Do you want the treatment with 2 minutes anesthesia? Because this is better, because bigger diameter means better result. But in the most cases, and the most easy for you is that you work with the 300 microns because there is no anesthesia and there is no downtime. So it would be the most easy way to start to attract the clients with the 300 microns because of those things, and then after slowly to build up the experience with a bigger diameter like 400 and 600, where you must put 2 minutes anesthesia. But try to put as the minimal amount of the volume as you can. This is another example of the reshaping of the buttock area. So conclusion, interstitial laser therapy for the cellulite represent completely new approach for the long-lasting cellulite removal, and this is a completely minimal invasive treatment, and this represents the future of the cellulite removal. Thank you for your attention.